Welcome to Abudoni Health Channel. The quality health tips you can trust.
You may be more likely to have high blood pressure due to your genetics, age, and whether you have certain health conditions. Treatment may include medication. Your blood pressure measurement takes into account how much blood is passing through your blood vessels and the amount of resistance the blood meets while the heart is pumping. High blood pressure, or hypertension, occurs when the force of blood pushing through your vessels is consistently too high. In this video, we'll cover the basics of hypertension, including its symptoms, causes, how it's treated, and more. What is high blood pressure? Narrow blood vessels, also known as arteries, create more resistance for blood flow. The narrower your arteries are, the more resistance there is, and the higher your blood pressure will be. Over the long term, the increased pressure can cause health issues, including heart disease. Hypertension is quite common. Hypertension typically develops over the course of several years. Usually, you don't notice any symptoms. But even without symptoms, high blood pressure can cause damage to your blood vessels and organs, especially the brain, heart, eyes, and kidneys. Early detection is important. Regular blood pressure readings can help you and your doctor notice any changes. If your blood pressure is elevated, your doctor may have you check your blood pressure over a few weeks to see if the number stays elevated or falls back to normal levels. Treatment for hypertension includes both prescription medication and healthy lifestyle changes. If the condition isn't treated, it could lead to health issues, including heart attack and stroke. How to understand high blood pressure readings. Two numbers create a blood pressure reading. Systolic pressure, top number, indicates the pressure in your arteries when your heart beats and pumps out blood. Diastolic pressure, bottom number, is the reading of the pressure in your arteries between beats of your heart. Share on Pinte 5 categories define blood pressure readings for adults. Healthy. A healthy blood pressure reading is less than 120/80ths of a millimeter of mercury, mmHg. Elevated. The systolic number is between 120 and 129 mm Hg, and the diastolic number is less than 80 mm Hg. Doctors usually don't treat elevated blood pressure with medication. Instead, your doctor may encourage lifestyle changes to help lower your numbers. Stage 1 hypertension. The systolic number is between 130 and 139 mm Hg, or the diastolic number is between 80 and 89 mm Hg. Stage 2 hypertension. The systolic number is 140 mm Hg or higher, or the diastolic number is 90 mm Hg or higher. Hypertensive crisis. The systolic number is over 180 mm Hg, or the diastolic number is over 120 mm Hg. Blood pressure in this range requires urgent medical attention. If any symptoms like chest pain, headache, shortness of breath, or visual changes occur when blood pressure is this high, medical care in the emergency room is needed. A blood pressure reading is taken with a pressure cuff. For an accurate reading, it's important you have a cuff that fits. What are the symptoms of hypertension? Hypertension is generally a silent condition. Many people won't experience any symptoms. It may take years or even decades for the condition to reach levels severe enough that symptoms become obvious. Even then, these symptoms may be attributed to other issues. Flushing. Blood spots in the eyes, subconjunctival hemorrhage. Dizziness. The best way to know if you have hypertension is to get regular blood pressure readings. Most doctors' offices take a blood pressure reading at every appointment. If you only have a yearly physical, talk with your doctor about your risks for hypertension and other readings you may need to help you watch your blood pressure. For example, if you have a family history of heart disease or have risk factors for developing the condition, your doctor may recommend that you have your blood pressure checked twice a year. This helps you and your doctor stay on top of any possible issues before they become problematic. What causes high blood pressure? There are two types of hypertension. Each type has a different cause. Essential, primary, hypertension. Essential hypertension is also called primary hypertension. This kind of hypertension develops over time. Most people have this type of high blood pressure. A combination of factors typically play a role in the development of essential hypertension, Genes. Some people are genetically predisposed to hypertension. This may be from gene mutations or genetic abnormalities inherited from your parents. Age. Individuals over 65 years old are more at risk for hypertension. Race. Black non-Hispanic individuals have a higher incidence of hypertension. Living with obesity. Living with obesity can lead to a few cardiac issues, including hypertension. High alcohol consumption. Women who habitually have more than 1 drink per day, and men who have more than 2 drinks per day, may be at an increased risk for hypertension. Living a very sedentary lifestyle. Lowered levels of fitness have been connected to hypertension. Living with diabetes and/or metabolic syndrome. Individuals diagnosed with either diabetes or metabolic syndrome are at a higher risk of developing hypertension. High sodium intake. There's a small association between daily high sodium intake, more than 1.5 grams a day, and hypertension. Secondary hypertension. Secondary hypertension often occurs quickly and can become more severe than primary hypertension. Several conditions that may cause secondary hypertension include kidney disease, obstructive sleep apnea, congenital heart defects, problems with your thyroid, side effects of medications, use of illegal drugs, chronic consumption of alcohol, adrenal gland problems, certain endocrine tumors. Diagnosing high blood pressure. Diagnosing hypertension is as simple as taking a blood pressure reading. Most doctors' offices check blood pressure as part of a routine visit. If you don't receive a blood pressure reading at your next appointment, request one. Medications. Many people go through a trial and error phase with blood pressure medications. Your doctor may need to try different medications until they find one or a combination that works for you. Home remedies for high blood pressure. Healthy lifestyle changes can help you control the factors that cause hypertension. Here are some of the most common ones. Developing a heart-healthy diet. A heart-healthy diet is vital for helping to reduce high blood pressure. Fruits, vegetables, whole grains, lean proteins like fish. Increasing physical activity. In addition to helping you lose weight, if your doctor has recommended it, exercise can help lower blood pressure naturally, and strengthen your cardiovascular system. Reaching an optimal weight. Managing stress. Exercise is a great way to manage stress. Other activities can also be helpful. These include meditation, deep breathing, massage, muscle relaxation, yoga or Tai Chi. Getting adequate sleep may also help reduce stress levels. Quitting smoking and limiting alcohol. If you've recently been diagnosed with high blood pressure, your treatment plan will vary depending on factors. These include the severity of your high blood pressure, and what medication your doctor thinks will work best for you. The good news is that in many cases of hypertension, lifestyle changes can be powerful tools for managing, or even reversing, your diagnosis. These changes include incorporating more nutritious fruits and vegetables into your diet, getting more physical activity, limiting your sodium intake, and limiting your alcohol consumption. Because hypertension often presents with no symptoms, it's important to get your blood pressure checked during your yearly physicals. Severe hypertension can cause serious health issues, so the sooner you have it diagnosed, the sooner it can be managed, and possibly even reversed.
Thank you for watching. Subscribe and like for more videos.